The World Health Organization Global Oral Health Status Report 2022 estimated that oral diseases affect close to 3.5 billion people worldwide, with 3 out of 4 people affected living in middle-income countries. Globally, an estimated 2 billion people suffer from dental caries of permanent teeth, and 514 million children suffer from dental caries of primary teeth. Prevalence of the main oral diseases continues to increase globally with growing urbanization and changing in living conditions. This is why on this episode of the program, Healthy Living on Trust TV, we will take a look at dental care with a focus on the benefits of maintaining good oral hygiene. We'll go over now to Dr. Anya Moakibo, who is a dentist, for more insights and perspectives on the subject. Welcome to the program, Dr. Akimbo. I know that the conversation today is around oral health, oral hygiene, but before we get right into that, I'd like for you to, as a backgrounder, tell us about the structure of the teeth and its functionality.
When it comes to health, oral health, or the structure of a teeth, we are looking at 3 main factors. When you smile, you see the gum. It starts with the lips before you see the gum, the teeth, the tongue, and the cheeks. There are so many factors to the oral cavity. Now, when it comes to the teeth, we are looking at 3 main components. The outer layer, which is the enamel, the middle layer, which is dentine, and the center of the tooth, which is the pulp. Now, at the outer layer has less nerves, it generally doesn't have nerve. So when you have a fracture of that outer layer, you may not feel pain, okay? But once it gets to the middle layer, which is the dentine, you start to have sensitivity, because we have what we call some dentinal tubules that send signals to the core, the center, which is the pulp. Okay, and once it sends signals to that pulp, that's where you feel pain. That's why, as we go into the conversation, you will find out that when you start having tooth decay, you don't feel pain at the initial stage. So if you don't show up at the dental clinic for checkup and cleaning, you see that by the time you start feeling pain, it has already gone too deep. All right. Okay, so we have, those are the 3 main structure of the teeth. Then we also have the part where you don't see, which is within the gum, the bone. We have the roots of the tooth. We have the crown. First is the crown of the tooth. Then we have the root of the tooth. Then if you divide it midsection, you see the enamel, the middle part, and the core. Now, around the root, we also have supporting tissue that holds the roots in place within the bone. Okay, we call them periodontal tissues. Yes, so all of these help keep the tooth in the mouth. So these are structures. This is the structure of a tooth.
What then would you say is the function of
this structure? Well, like I said, the periodontal ligaments hold the tooth within the bone and supports the tooth when you are grinding. Okay, you have the crown, which is where we see when you smile, or your chewing surface. It helps with chewing. Okay, when you're chewing, you're grinding, you're using the crown part of your teeth to chew. The root part is within the bone, which gives support for the pressure you use in grinding. So these are the functions.
What would you say are the causes of this, or what are the major oral diseases and also the causes of these?
Most prevalent oral diseases within working age children to adults would be dental caries. Dental caries is simply put tooth decay. This is when the hard part of the teeth or the tooth is demineralized, meaning it becomes soft, it's damaged, and then there are some other activity that goes on within the tooth to extend the decay even further. So dental caries can be seen in children, in adults, and even older people in some cases, depending on their diets. Okay, we also have other dental conditions like gingivitis. Now we are expected to come see the dentist every 6 months for scaling and polishing because of gingivitis. Gingivitis simply means inflammation of the gum. This is the red part where you see when you smile, the red part of your teeth. That's inflammation of the gum. It may not look obvious at the beginning, or after a long period of time. You won't see people going about with red swollen gum, because these are the features of inflammation. But it gets chronic, that any small probing you see bleeding. When you brush, when you notice that when you brush you see bleeding, or you have brushed, it doesn't take up to 12 hours, your breath is not smelling so fresh, then you definitely need to see the dentist. So that is gingivitis. Now we have chronic and acute, which is what I try to explain. The acute one is the one that appears reddish. The one that doesn't appear reddish, it just pales, just there, is the chronic gingivitis. Also, we have periodontal diseases. Periodontal diseases is when the supporting tissue I explained earlier that hold the roots within the tooth and the gum becomes damaged through our habits. Now we have people who, when they eat, you see them, they start using toothpick. Okay, they are pushing in indeliberately, pushing in more food debris within the gum. Okay, and this would lead to introduction of bacteria within that gum, food substance, and decay. And now your body tries to fight off that decay and inadvertently damage tissue around there. And then you notice that you are having pockets. That means a space where food packs in when you eat. That's pockets. Now you still go ahead and keep trying to use a toothpick to break it, and then it's just a spiral, and then it keeps getting worse and painful, and before you know, you have to miss a day at work because of that. This is periodontal disease. We also have ulcers, mouth ulcers. This could be due to stress, okay, or low blood counts and all. So you might need to watch your diet. Some people react to certain fruits. Some people, they can't eat things that are citrusy. They get blisters and sores. Hepatic gingival stomatitis. Okay, when you go to playgrounds, you see that they share sweets, share spoons. You know, it's transmissible in children playgrounds. Okay, now you have blisters, you have drooling, they are irritable, they don't want to eat. All of that affects the entire health of that child. So coming to the dentist regularly, or when you notice any discomfort, would help a great deal in curtailing many of these diseases and prevent them from getting even worse.
For the dental caries, I like to know what exactly is the cause of that.
4 factors that lead to dental caries, which is the prevalent dental disease among adults and children. So now we have tooth surface. We have that, your teeth. Bacteria, we all have bacteria in our mouth, from passing through the birth canal, picking things from the floor. Over the years, we accumulate bacteria in our mouth, but these are not harmful to us. But it depends on the condition. When the immune system is down, they can become very, they can proliferate, okay, meaning increase or dominate, and then they become unpleasant. We have to treat. But otherwise, they live there. They are okay. Now we need food substance. Now the kind of food you eat plays a very important role with the prevalence of dental caries, with your incidence of having dental caries. Okay, say for example you like sticky sweets, chocolates, biscuits, processed food, or processed sugar. These have higher chances of sticking on your teeth. Now when this sticky food rests on your teeth and you don't brush, okay, bacteria living in your mouth feeds on this food and produces an acid that breaks down this hard substance, which is your enamel. He breaks it down and becomes soft, and then more bacteria go in and demineralize the tooth. Now all of this doesn't happen in one day. It takes time. So that is where time comes in. Now, say for example, you don't brush at night. I usually advise my patients, you can not brush in the morning. Don't worry, somebody will tell you in the day. But if you don't brush at night, nobody tells you, but you have a high chance of getting caries. Okay, so it's as important as brushing in the morning, brushing at night. So if you don't brush, these bacteria feed on the food on your tooth surface, produces an acid, and within the period 12 hours from when you last brushed to the next time you are going to brush, that's 24 hours, because if you read your toothpaste, they say it has protection for 12 hours. So you have 12 hours for these bacteria to have fun and produce acid that breaks down your teeth and demineralizes it. So these are the main four factors.
Now, I understand that there are products out there that people use to help cater to their dental health. But as an expert, I want to hear from you. How do you think, what's the best measure to go in taking care of our teeth?
Taking care of your teeth is priority. It's very important because the mouth is the gateway to the body. Whatever you put in your body goes through your mouth. It's only the sick people that have to take needles and injections. But once you're healthy, it goes through your mouth. So you need to take care of your mouth. Now, when it comes to taking care of your mouth, we have different options. But the best and the recommended one is brushing. Now, when we come to brushing, like we explained earlier, when food sticks to your teeth, bacteria feeds on it, produces acid and damages that teeth, right? Brushing removes food debris lodged on your teeth. So bacteria doesn't have what to eat to break down your teeth. That's very important because it breaks the circle. Okay, so brushing is very important. Now, it's not just brushing. You can't just take abrasive salt and brush your teeth, or baking soda, which of course works, but there is a vital importance in it, something very important that we need in brushing our teeth or keeping a healthy teeth. It's called fluoride. Now, this is very tricky. Fluoride can be poisonous. Yes, we have had cases in northern Nigeria where they had excess fluoride in their water supply, and we noticed people had fluorosis, vomiting, and all. In fact, some of our patients, when you see their smile, you know that they are from this part of the country because it's prevalent there. Something happened to their water at some point in time. Fluoride can be very dangerous. But the little minimal quantity we have in our toothpaste serves us okay. And you don't need that advert size when you are brushing, the kind that you see on TV when they want you. You don't need that much. Okay, just enough to brush.
Marketing of food and beverages high in sugar as well as tobacco and alcohol, according to reports, has led to a growing consumption of products that contribute to oral health conditions and other NCDs. We'll go on a quick break now, and when we do return, we'll pick up the conversation around good oral hygiene. Don't go away, we'll be right back. Welcome back. If you're just joining in, this is the program Healthy Living on Trust TV, where we have been exploring perspectives on how and why it is necessary to take proper care of the teeth and maintain a good oral hygiene. And I still have with me Dr. Anyamu Akinbo Okungbowa, who has been doing justice to this subject. I know before we went on the break, you were talking about fluoride in toothpaste and it's the dangers it portends, especially if we have it in excess amount. Now, I'd like to know, you talked about brushing. I know that for some people, they do not subscribe to using the toothbrush, though they rather use the chewing sticks. I'm talking about some people in some parts of the country that subscribe to that. What do you think about what's the difference between using the toothbrush and the chewing stick?
Using chewing stick is fine, as much as if you prefer that, is fine. Now, the challenge with that would be the technique you are using. We don't mind you using chewing stick because our forefathers were using chewing sticks, served them right, okay? They had the use for it, which led to development and what we have now. But that doesn't mean that we want to scratch it out. There are people who prefer it, and we encourage them to. Also, we would advise that in as much as you use your chewing stick, we don't mind that you use a little bit of fluoride. After you have chewed it, you have brushed, you use a little bit of fluoride containing toothpaste, as minimal as we have explained, and do the brushing with it because of the importance of fluoride in your toothpaste. It strengthens your teeth. Minimal quantity, it strengthens your teeth, and you spit out. So when I say technique, now if you notice people that use chewing stick, they do this. Okay, now in doing that, one, you might use heavy pressure, a lot of pressure. That's one. And in that movement you are making, it can damage the gums. Strip the gum off the neck of the tooth, exposing the roots that is not supposed to be exposed in the first place, and lead to sensitivity and damage in the long run. So how you use it is very important as much as why you are using it. How you use it, when you are brushing, you have chewed your chewing stick, is now fluffy. You don't need to do a vertical motion up and down. You need a rotary motion. When you do a rotary motion, it can cleanse your teeth without damaging your gums. So that's fine. Just the technique. And then also introduction of fluoride containing toothpaste.
What about the technique of using the toothbrush?
It also applies. We're talking. We are just getting to techniques or brushing techniques. We have what we call the wrist roll method. Now I'm sure you have heard or seen on all the skits where people are brushing and their gate man can hear them brushing. It's making so much noise. You don't need that much force when you are brushing your teeth. You don't. The same pressure you use in cleaning your precious jewel, that's how much pressure you use for brushing your teeth. Okay? Not so much force. That's one. And when you brush, you use the wrist roll method. If you can see the motion I'm making, I could show you with this. Say you want to brush. This is a mannequin. Now when you're brushing, we advise that you keep your mouth slightly open, okay, not closed, so you can see everything you are brushing. If you close and you do this, can you see you are not effective? So you open slightly and you do the wrist roll technique. Sometimes I sing with it for children. I roll my wrist, I sweep it out, I roll my wrist. So you sweep out food debris, and while you are massaging your gum, sweep it out. So it can even get in between crevices, as opposed to doing this or doing this. When you do this, you strip, this is the gum, you strip the gum off the neck of the tooth, exposing the root part, which is not designed to be in, open. It's not designed to be open. And then you have sensitivity. That leads to sensitivity. So you don't need that. You need the wrist roll technique. And then you do this. I roll my wrist. I sweep it out. Can you see that? You do that for the upper parts. Okay? You do that. And then for the lower as well, you sweep upwards. Yes, not down. Because the aim is not to damage the gum. The gums are this way. If you strip them, they get damaged. So you sweep upwards, okay, you roll your wrist, you sweep it out. You see, I've gone to the lingual side, which is the inner parts. Okay, you sweep out, and then the occlusal surface you brush as you should. Okay, you brush as you should. What kind of toothbrush do you need? A medium texture brush. We have different types. You see the hard, the soft, and the medium. You do not need a hard brush. I keep saying that again and again. You do not need a hard brush. The only time we get to use a hard brush for our patients is twice a year when we do polishing. And we do not do the up and down technique. We do a rotary motion. We use a rotary motor to use a hard brush to smoothen the surface of your teeth after scaling and polishing. We call it, after scaling, it's called polishing. Okay, that's when we use hard brush. So everybody, even when if you're a smoker, you don't need that brush called the smoker's brush. No, you don't. And there are people who say they feel uncomfortable when they don't use hard brush. If you are able to brush your teeth twice daily with a fluoride containing toothpaste and a medium texture brush, and you come to the clinic twice every year for scaling and polishing, you find out that you don't even have need for mouthwash. Okay, you don't have need for mouth, because most of the mouthwashes they sell out there, you really don't need it. This is a dentist's advice. There is only one ingredient. There is one main ingredient that we require when it comes to gum health and mouthwash uses, is chlorhexidine. So if you are getting any mouthwash, it has to have chlorhexidine, and you don't use it for a long period of time, just for about a week, because it can cause stains on your teeth. So we prescribe it after a treatment has been done, and you use it for about a week and you discontinue. Okay, so after brushing around your teeth, make sure you brush the inner surface and the grinding surface. Remember to brush your tongue. Some people brush their teeth and they forget about their tongue. Now we have what we call the tongue scraper. I could show you one. I didn't keep one here. A tongue scraper you use to clean the surface of your tongue, because that could have bacterial load. We didn't mention halitosis when we're talking about oral diseases, which is mouth odor. People come in here every time saying they are concerned about their breath. It could be as a result of a pathology within the mouth, a hole in the tooth, hole within the gum, periodontal disease, or even coating on the tongue. Bacterial load of debris and coating on the tongue can lead to halitosis. So when you use a tongue scraper, it reduces that as well and gives you a fresh breath. All in all, you don't need a hard brush. Flossing is very important during brushing of teeth. After brushing your teeth, you have successfully cleaned at least 64% of your teeth surface. Now, the part in between your teeth is about 34% or 36%, and you haven't cleaned that yet. That's why flossing comes in. Flossing is as important as brushing, where you use a thread-like material to clean the mesial surface, proximal surfaces of your teeth. Okay, so now when this plaque moves into those proximal surfaces, which is the gap on the sides of your teeth, when the plaque moves in there, your brush can't get there, right? Now, over time, it absorbs calcium from the saliva and becomes hard. Then it turns to what we call calculus. Heavy stone. It looks like stone. It's there in between. There are different sizes. Depends on how poor the oral hygiene is. Okay, so it builds up by absorbing calcium from your saliva and just sticks on your teeth. Now, while it's sticking on your teeth and building itself up, it's damaging the gum of that teeth, it's getting it inflamed. In fact, it even leads to halitosis. Okay, so this is why you actually come to the dentist, to remove those calculus and plaque, to remove them. As they have stuck to your teeth, your regular brush cannot take them out. So we use our ultrasonic scaler to try and bring them out of your teeth in those crevices your brushes don't get to, or you skipped or you missed in 6 months. You come, we clean them, and then we polish them, we smoothen the surface.
Okay, so what would you say? I know we've talked about the oral diseases. What would you say are the health system challenges to help for oral health now, to help curb some of these diseases that we've talked about? What are the health system challenges?
Well, from my observation, I noticed that dental is not factored in the primary health care system. that is the grassroots first contact to the people within the inner cities or the far-reaching villages, the primary health center. And dental has not been factored, which is not very good, which is something the government should look into. Now, at that stage, if a child or an adult walks into a health care system and complains of dental, because dental procedures are a bit on the high side, maybe not a bit, it's on the high side, because most of what we do, we don't produce them here in Nigeria. We have to import them, and before using them, making our price go high and, affected by the dollar exchange rate here and there. Aside that, negligence on awareness in the inner cities, people are not, even in town, people are not aware that some of their health insurance covers this procedure, even if it's just consultation and the regular scaling and polishing. They're not aware. And people who are aware don't have time to come. People that need it don't have health insurance. These are some of the challenges. People that need it, the children in the inner cities that need it, they don't have health insurance to cover for it. So in bid to curb that, some of us usually do health outreaches into the inner cities to try and educate people, one, because if you don't know you have a challenge, you will not seek help. Okay, so we go in and educate them and try as much as possible to provide for them, as small as it is, a sachet of toothpaste, so that they can add to their chewing stick while they brush. Okay, now seeking dental health, dental checkup and treatment as soon as you notice anything, or let's just place it on 6 months regular, because it takes more than 6 months for you to start having dental ache that leads to pain. If you don't show up in 6 months, that means there's probably something going on in your mouth you cannot see, but by the time you're having pain, it has gone too far. Because we said it goes through the 3 layers. The enamel, no sensitivity, no pain, no discomfort, right? But when it gets to the dentin, you start having sensitivity, you start having discomfort. But when it gets to the pulp, you may not be able to sleep at night. You will take pain reliever, it's not working. They'll say, go and buy one, touch and go. That doesn't work. It just damages tooth even further. All of these are the challenges we face in the health, both from the government aspects, the healthcare system, and bridging the gap between the dental health practitioner and the people that need it.
As a final word, just in summary, what would you recommend as the best measure towards maintaining good oral hygiene? Just in one sentence.
Brush twice daily. Visit your dentist every 6 months. Use a fluoride containing toothpaste and a medium texture brush. If you have all of these things in check, you shouldn't have any problem with your dental.
Maintaining a good oral hygiene is just as important as any other personal hygiene. In an event you notice any oral disease, it's important you visit a dental clinic or see a dentist so you can prevent before even having these diseases. And that wraps up the episode of the program today. For comments, contributions and suggestions on this episode, do well to follow, like and subscribe all of our social media platforms. Join us again on another episode of the program Healthy Living on Trust TV. I'm Aisha Salihu. Thanks for your time.